inflammation in blood vessels. So reports from all over the world, including some from here and from other places, have demonstrated that there's at least this virus seems to be causing a syndrome that's quite a bit like Kawasaki disease. So everyone's been concerned about that. Kawasaki disease can cause damage to the coronary arteries of your heart in a long-term basis. So there's treatments for that, for the routine Kawasaki disease. We're obviously concerned with these kids' heart arteries to make sure that they recover fully and don't have problems later in life. So we've seen 2 cases of it, which was quite distinct. It was only been described for the last couple of weeks. There's probably 20 to 30 cases abroad that have been very well described. There are now cases in New York City that have been described. And someone called us from Kentucky this past afternoon saying they have the exact same case that we had here. So it is, I think it's traveling around with the virus, and we're sort of seeing more and more of it as it comes along. The first kid that came in here was the exact right age, right around 5 years of age. He had classic symptoms of a rash, lymph nodes, cracked lips, swollen tongue, and if COVID was not involved at all, we would have just said it's Kawasaki disease, and that was it. But he tested positive for COVID in his first day here. He also had a tremendous amount of shock. His heart was in failure when he got to us. He needed a lot of therapies to get over that. He's doing quite well now, but 3 or 4 days of intensive work to get him into the right state. The statements from the early part of the pandemic overseas in China and Italy and places was certainly that kids are less affected than adults, and we were all happy to hear that. I'm an ICU doctor, takes care of kids. Everything that weird happens comes to my doorstep, so I'm always skeptical. So we're happy that kids are not as affected as adults necessarily with this disease, but any little change in that process could put kids at risk, and so we're obviously on the lookout for those things. This virus is 4 months old, and the fact that it hasn't affected kids so much so far is great news, but I'll believe when I see it, when it's all over and kids have been fine. Most viruses affect kids more than adults. And so this is a very strange virus in many ways, but affecting adults more than kids is usually backwards. The youngest kids usually get affected just as hard as senior citizens do. So it's nice that it hasn't affected them quite so much yet, but we're here to make sure that everyone's safe and make sure everyone gets through this the best they can.